So what is perimenopause? Perimenopause is the time that surrounds menopause, and it happens before menopause. It's a time where period changes can start, menopausal symptoms can also start. And for women, on average, it happens around 45, but there are women in their late 30s where this can start to happen, and there are women in their 50s that this can start happening. So it all depends and varies. But age 45 is the standard and the most average age that it can happen. The first thing that tends to happen is women start feeling more tired or start gaining weight or start to have symptoms like, insomnia, vaginal dryness, and mood swings. And that's due to fluctuations in hormones that can happen from month to month. They may also start to experience changes in their menstrual cycles where their cycles come on more frequently, or they start to skip a month or two, or bleeding becomes heavier or lighter, or they'll start noticing spotting at different types in the cycle. So there's a lot of variations in how cycle changes can occur in perimenopause, which is what makes it very difficult to not only endure, but also as a physician or doctor to also treat. And so a lot of testing and a lot of experimenting has to happen. Unfortunately, if you go to a traditional medical route, they'll offer birth control to kind of stabilize things or offer hysterectomy. And in some cases, those treatments are actually very suitable and viable for a patient. But for most people, most of the times, there's other better options. And that just takes some diligence and testing and communication back with the patient and providing some beneficial supportive treatments. And it could be from a nutritional or herbal standpoint, or it could be from a hormone replacement therapy standpoint as well. It's often a myth to think that hormones can't be introduced until women enter menopause, and that's absolutely not true. Many perimenopausal women truly benefit from, let's say, estrogen or progesterone replacement therapy, and it all depends on what's communicated to the patient and what her goals and beliefs are around that. So a lot of education is definitely warranted.